Good morning. Hope you are doing well. Today I will continue talking about the energy requirements. As you know from previous lecture, total energy requirement has three components, including basal metabolic rate, physical activity, and thermic effect of food. In addition to the main components, there are some other factors affecting total energy requirement. These are first growth, pregnancy, and lactation. Regarding growth, additional energy is required to cover the cost of increasing body weight and height. A growing infant may store 12 to 15% of energy expenditure for growth and formation of new tissues. When the child gets older, his rate of growth is diminished and the caloric requirement for growth is reduced, but the total energy requirement is increased because of increased body size. This table shows the energy requirement according to age. For example, a child aged 4 to 6 years, he requires 90 kilocalories per each kilogram of his body weight. And as you see, at puberty, the energy differs according to gender. Concerning pregnancy and lactation, during a pregnancy, women need extra kilocalories, that means extra energy, to build up their own tissues, to build fat stores for making breast milk, and lastly to build the baby and the placenta. Additional calories are required to meet the energy cost of pregnancy and lactation, will add it to the total energy requirement of a normal woman. In pregnancy, 300 kilocalories per day will be added, especially in the second and third trimester. In lactation, 500 kilocalories per day will be added. Now we have to solve this problem. A 30-year-old housewife, her ideal body weight is 60 kg. Calculate her total energy requirement. Because she is housewife, so she is moderately active and her physical activity represents 40% of basal metabolic rate. To calculate her basal metabolic rate, we have to multiply her ideal body weight by 0.95 because she is female to obtain the basal metabolic rate, and we have to subtract the 10% of the sleep from the basal metabolic rate and calculate the physical activity, which represents 40% of the basal metabolic rate. Then the thermic effect of food, we choose the thermic effect of mixed food, which is 6%. Then lastly, we have to add these three components together to obtain the total energy requirement. If she is pregnant, we have to add 300 kilocalories per day. So the energy requirement is 2,161 kilocalories per day. But if she is lactating, we have to add 500 kilocalories per day. That means the total energy requirement equal to 1,361 kilocalorie per day. Also, you have to know how to calculate the energy requirements in overweight person. The one commonly used technique is to use an adjusted weight, which is the ideal weight plus 25% of the difference between the observed and ideal weight. So the equation is ideal weight plus 0.25 multiplied by the difference between the observed weight and ideal weight. This is an example on how to calculate the total energy requirement for an overweight person. 46-year-old lady with ischemic heart disease. Her weight now is 85 kilogram. Her ideal weight should be 68 kilogram with a light physical activity. Calculate her total energy requirement. Because she is an overweight, we have to use the adjusted weight, which is equal to ideal weight plus 0.25 multiplied by the difference between the observed and ideal weight. So the adjusted weight obtained from this equation is equal to 72 kilogram. Then we have to calculate the basal metabolic rate, but using the adjusted weight instead of the ideal body weight. And don't forget to subtract the 10% of sleep from the basal metabolic rate and calculate the thermic effect of food. We use the thermic effect of mixed food, which is equal to 6% of basal metabolic rate, then the physical activity, which is light. So we have to multiply the basal metabolic rate by 0.3. Then we can calculate the total energy requirement by adding the basal metabolic rate and the thermic effect of food and physical activity. Therefore, the total energy requirement in this patient is equal to 2,065 kilocalorie per day. Thank you for your attention and your listening.